When I was in college, I started to participate in ambulance services. And by taking patients to the emergency department and to the various hospitals, I found that I really had a love for the emergency medicine profession. I always was curious what happened. I dropped them off at the hospital, but then whatever happened to the patient?
Our focus is on making the patient feel comfortable. Coming to the emergency department can be so stressful, and we want to make sure that they know that they're going to come here and we're going to make it as comfortable as a process as possible.
Nowadays, people are specifically trained in emergency medicine. Like you would do a residency in surgery or a residency in internal medicine. Now we do residencies in emergency medicine. So we are specifically trained to handle any type of emergency that can come through our doors. We only hire experienced physicians here. They require 5 years of experience after residency before we will hire them into our practice. So what does that mean for you, the patient? It means you're going to get better care by an experienced physician who all they do is emergency medicine.
We've updated our technology such that we are able to see an EKG from a patient that's still at home with a medic. So for example, if a patient has chest pain and calls 911, the medics can call us as they're bringing the patient to the emergency department. They can let us know that they're concerned that the patient's having a heart attack, and not only that, but send us the EKG via fax. So before the patient's even arrived, I, as the emergency physician, can have the EKG in my hand and get the team mobilized to get this patient up to the catheterization lab. And having that information readily available makes a big difference in the time for the patient to get the care. The testing that we have available in the emergency department is focused on getting the testing done as quickly as possible, as many diagnoses can be time sensitive. Our CAT scanner, for example, is located just next to the department. So if we have a patient that we're concerned about having a stroke, we are able to get them from the emergency department to the CAT scanner very quickly.
A lot of times you'll be sent as a patient directly to the x-ray area, so when you're finally seen by the practitioner, your x-rays are ready. I can look at it as I'm looking at you, and together we can make a decision as to what your best care would be. We have the capability here of digital x-rays. What digital x-rays do for you as a patient is, first of all, it's less radiation exposure. Plus, we are able to look at it directly while in the emergency department real time. I can also have our consultant or orthopedist, if it's a fracture, look at it with us, and together we can make what is the best patient decision for you given these x-rays. We have cardiologists that are on call 24/7 who could be at the bedside within minutes to help us with cases that involve any type of cardiac issues, heart issues. Doylestown Hospital has the specialists available to take care of you and your needs when you come to us. We are very lucky here at Doylestown Hospital to have a wonderful and compassionate bunch of emergency nurses. The nurses are capable of taking care of a little baby up until an elderly patient. So we are very lucky, and we work side by side with these nurses every day. It is a great team.
Doylestown Hospital Emergency Department has been recognized both in 2012 and 2013 by the Press Ganey Association for our patient satisfaction scores, which have been over 95%. We work phenomenally well as a team. And it's not just the emergency department, but the other services as well. We meet on a regular basis to make sure that we're meeting all our guidelines, and we also ask ourselves, how can we do this better?